A spokesman for the DR Congo government said cases were now being reported over a wider area. There are also 2 confirmed cases and 1 death in Uganda, says the U.S. Centers for Disease Control and Prevention. The World Health Organization has declared the outbreak of the current strain of Ebola, which is caused by the Bundibugyo virus, an international emergency. As this deadly Ebola outbreak continues to spread, the Congolese government has sought to reassure people that its response teams are working hard to trace and investigate suspected infections and that there is no need for panic. However, with cases now identified in new areas, including Nyakunde in Ituri province, Butembo in North Kivu, and the city of Goma, concern is inevitably growing.
In the middle of the chaos, ebadde mu ggwanga corruption, waliwo embeera ebadde ebrewinga oba ebadde ekula. Njogera ku Ebola virus. We are getting a picture nti Congo akawuka kabaddeyo nga oyinza okugamba it's been poorly controlled. Omanyi kweno channel oba mupya wano nkyogera nga wekiri. It looks like the virus has been poorly controlled mu Congo. The numbers right now ze reporting is Ebola nyingi okusinga Congo idea gyawensi. We share a border with Congo. Ekitegeeza nti the disease can easily spill over into Uganda. So right now, globally attention is focusing on Congo and Uganda. Oyinza okugamba nti our neighbors have dragged us into an issue ya Ebola. Uganda government ngola ku screen yawo ba cancelling Uganda Matters Day 3rd June. Bagezaako controlling crowds because they know abantu abajja okulamaga they come from Uganda and neighboring countries, including the epicenter, Congo. Already effect etandise okugwawo. The government came out issuing a statement. I'm sure abasinga obungi kuffe twagimiisinze because tubadde bintu bya corruption, speaker, operations and what. Njakuwa obudde so posinga n'ogisoma, but in summary bakugamba nti Uganda Matters Day has been cancelled to try and safeguard the lives of Ugandans. Now the question is, aren't we late? Tekizze late kino cause tukimanyi nti borders e Uganda they are so porous. Abantu ku border asala nadde eri. If you put regulations in place, abantu bagenda respecting her. And now we are hearing stories in Bwechiri mu Congo. It's boiling. The numbers are much larger than initially anticipated or initially reported. It's possible nga ku side eri e Congo ekintu kiri out of hand. Cause akawuka kapya. Ebola is a virus. Kitegeeza ki nti they mutate oba zikyuka mangu nnyo. Nti omwaka guno oba olina Ebola virus A, nko example, omwaka ogujja egenda kukyuka efuuke Ebola virus B. So yinza okugamba nti buli mutation we happeninga n'akawuka kafuuka tricky okujjanjaba. Tukimanyi nti wabaddewo vaccine ya Ebola naye ebadde ekavaringa kali akawuka akalala. Mu kaseera kano tuwulira nti we have Bundibugyo virus strain. Tewali vaccine. Basobola okukola supportive care ne bakujjanjaba ne bakontrollinga temperature, vibes and inshallah. In summary, kwegamba they support you. Janjaba temperature, rehydrate and pray. Fingers crossed. So mukasera kan we're hearing nti wawo strain empya eyavudde across the border e Congo and etanso okuspillinga mu Uganda. Why is this significant? Kankuzeyo wano. The US Embassy in Kampala yapozinze visa services over Ebola outbreak. Oyinza okugamba nti nga we nagambye we've been dragged into something that number one we have no control over because you can't control a spread of a virus. You can't. It's difficult. You can put measures. N'ogamba nti social distance, munabe engalo, reduce greeting, naye to what extent? tuli bafirika, we love kukwata abantu mu ngalo. Ebola is a virus etambulira mu bodily fluids, meaning ebintu nga kissing, okwegatta, okukwata ku musaayi, okukwata ku ntuuyo z'omuntu ng'alina Ebola. Kizibu nnyo okontrolinga virus, spreading amangu nnyo. Kitujjukiza 2019-2020. Sijja kwogera linnya, YouTube eteekawo embeera. Nekyemanyi gwandaba, you know what I'm talking about. It brings back the traumas Ugandans went through. Mu kaseera kano tufunemu okutya. This can easily get out of hand ne tuddamu eyo embeera. Naye nga nkugambye kino kitiisaamuko. Kampisewo kino. Omuntu yenna nga obadde olina program etambula eva mu ggwanga. Either ennyonyi girinnya ekiro kino oba enkya ku makya oba olweggulo. Cause emikisa mingi nnyo. According to the talks happening on the global scene, nti Uganda, Congo and the neighbors, abeetoloddeawo, our neighbors, tuyinza okugenda ku red list. Nti entambula eyinza okukaluba mu maaso awo. Regulations oba restrictions zigenda kujja. Cause tewali muntu ayagala ku importinga Ebola mu nsi yaabwe. Etiika. It can easily kill you. It's a viral hemorrhagic fever. A deadly one. Nti wogifuna nga nkugambye mu kaseera kano we don't have kangambe a cure. They support you. Mwa amazzi, control the temperature, keep fingers crossed, musabe. Inshallah, oba afaafe oba wonaawone. Tufunye information nti waliwo Omumerika eyatestinze positive. Era nti agenda kutwalibwa e Germany asobole okufuna obujjanjabi eyo. We've seen a video nga Trump, White House, they are worried. They are concerned. And the rest of the world is watching. Mu kaseera kano, the discussion is DRC, Uganda, neighbors. What happens next? I see a situation where tugenda ku red list. Omuntu yenna ng'ogenda kutambula. Ekiro kino oba enkya oba the night yenkya linnya ennyonyi nga bukyali. If you have programs. Otherwise, oyinza okuyita mu kaseera akazibu ennyo okufuluma eggwanga. Because concerns are growing over the spread of Ebola and the new strain eya bundibujjo virus. Katandike video.
Ebola, you said Ebola.
Yeah. Should Americans be concerned about Ebola?
I'm concerned about everything, but certainly am. I think that, it's been confined right now to Africa, but it's something that has had a breakout. I could ask Bobby or Oz to say a couple of words about it if you'd like. Do you want to do that?
I think Heidi Overton is going to come up and give us a few words here. Dr. Overton.
Thank you. Thank you, Mr. President. Thank you. Today, the CDC held a press briefing that provided a lot of the answers and information, but we have stood up a full interagency response. The Department of State, the CDC, the Department of War, everyone is fully involved in tracking. Today, we do have an announced today at the press briefing. There is an American that is symptomatic and has tested positive for, it's the Bundibugyo virus, a strain of Ebola. That American, as well as 6 other high-risk contacts, are going to be taken out of that region and taken to Germany. We want to thank our German counterparts. That is an internationally recognized location for viral hemorrhagic fever treatments. So we're very grateful that they would take them. It's a significantly shorter flight time for Americans to receive treatment there in Germany. For all other Americans, we have issued travel warnings. We have instituted just today entry restrictions for non-U.S. citizens that have been in the region in the past 21 days. So in Uganda, Democratic Republic of Congo, and South Sudan. So very serious measures that have been taken. We are working to communicate very frequently with everyone. Your question was, should Americans be worried? Right now, there are no cases of Ebola in America. We want to keep it that way, and we are doing everything we can to support Americans in the region. Thank you, Mr. President.
The concern is growing. Ngolema kuka video, they are concerned. Of course, balance oku acting abakugambye nti non-US citizens ababadde in those countries, Uganda, DRC, Sudan. bataddewo restrictions. This is going to grow. Kigenda ku-expandinga. Naye, putting the anxiety aside, n'okutya, I'm sure all of you, naye kenyinyi, we have full confidence mu basawo baffe Uganda, but nurses, we can handle this. There's no need for excitement ogamba nti omuntu omutwala simanya e Germany for isolation okujjanjaba a virus. We can fully handle this mu ggwanga. Naye, it has to be a collaboration between us now and ever. Be careful. Follow the regulations. Mu kaseera kano nga nkugambye, it's hard no matter what the government does or containing a virus. Is it possible nga Ebola yayingira dda? Kisoboka. Nga nkugambye, the borders are so porous. DRC, Sudan, Uganda, abantu bayitawo buyisi. Tuyina abantu abavuga trailers. Agenda, we know them for these habits. Nti ayina abakazi buli station. E Congo, e Uganda, so are just spreading ekirwadde kino. They come in contact with bodily fluids a lot. Lwaki nkoza example yaba long distance trailer drivers cause tukimanyi in the spread of in epidemics they play a big role in the spread of viruses cause bebasinga crossing borders. Tuina abantu abera ku borders DRC, Uganda, Sudan. So kizibu, it's difficult. It's tough. So it's a collaboration. Buli omu alina okuzanya party ye. Gwandaba gezaako nnyo okufollowing the regulations government ze betaddewo. But this appears to be, mundowooze yange, don't take my word for this. It seems this is worse than we are reporting. It seems this is worse than we are seeing. Kisoboka okuba nga abantu bangi ku border especially kyabalya dda. Nenga nkugambye, I have full trust mu basawo baffe ba nurses to contain this. They can manage this. Naye, the global scene is worried. Nalabye WHO Secretary General nga agezaako okunnyonnyola the extent to which Ebola wetuuse. Watch.
I'm deeply concerned about the scale and speed of the epidemic. First, beyond the confirmed cases, there are more than 500 suspected cases and 130 suspected deaths. These numbers will change as field operations are scaling up, including strengthening surveillance, contact tracing, and laboratory testing. Second, cases have been reported in urban areas, including Kampala and the city of Goma in the DRC.
Of course, Uganda, Ministry of Health yavuddeyo negamba nti oyabadde mu Congo, si muna Uganda. Era they took all the measures, ne bama isolatinga. I've heard nti bamuzizza ye Congo. So far we are doing a great job. We are containing this issue naye. Ng'omwami wakugambye nti there are 500 unreported cases. Mulimu abali asymptomatic nga tosobola kutegeera mbu alina ki? Ebola. So be careful.
Third, deaths have been reported among health workers, indicating healthcare-associated transmission. Fourth, there is significant population movement in the area.
Embeera etiisaamukko. Mbadde ku X ndaba nga waliwo abantu who are trying so hard to push for Mother's Day nti bakuŋŋaane. Bo nga bagamba nti tuleke bannayuganda bokka bokka bagende okulamaga nga 3 June. Nti abantu abagenda okuva wabweru w'amawanga oba wabweru w'eggwanga tuba stopping. Ogenda kikola otya? They will sneak in. Nkugambye borders are porous. Follow the government regulations. Obwedda bagezaako okukola preparations nti balongoosa, they are spraying in the hopes that government changes their mind babakkiriza okukola ki? Okukuŋŋaana. Mother's Day will never cease to exist. Mujja kikola omwaka ogujja. Guno omwaka nedda. Do not take us back to 2020, 2019. Eyo embeera saagala giddamu. Eyo embeera traumatized us. we still have memories. Tujukira bulungi nnyo. We don't want to be indoors. Embere yakuba businesses zaffe yatuza ku zero. We don't want to go back. Just because of one denti temusobola kulinda. You can wait. Mujja kulamaga omwaka ogujja. Follow the government regulations. Government, they've banned it. And I pray the government does not be pressured or become tempted okukyusa endowooza yaabwe. Waliwo ku CNN, they were discussing the same issue. Nga beebuuza ekibuuzo kimu, why always Congo? Lwaki Congo? Of course tubamanyi nti ku side ya border, nina okubeera careful ne language yange. Balina emmere gye bali ey'enjawulo, including obuwundo. Ate nga one way of catching Ebola, nkugambye, bodily fluids, malusu, ntuuyo, musaayi. Naye ate n'okulya obuwundo, a specific type of bat gye bayita fruit bat, kaba kayina Ebola. Sijja kyogera. Wakyamba njagala okwogera, but let me stop. So ku CNN badde beebuuza, why always Congo? And I loved the segment, ngenda kakuzannyira. But naffe tulina okwebuuza, why always Congo? Nga Ebola gyasibuka buli kaseera. Can't they learn nti at one point twakola kino ekintu ne kireeta tabbu mu region, lwaki mukiddamu? Why don't you learn? Okay, kankyogere, lwaki oli akawundo? Temwina mmere? Don't you have food? I could sound mean, but I'm concerned. Ebintu nga bino can paralyze right now travels mu ggwanga lyaffe. If you have a business, it can slow it down. Nga olabe USA nga eteekawo restrictions, I'm sure, kino nkigamba, I'm very sure other countries will. If America does it, others will did it. CNN, yagambe wait. Watch.
Uganda has been at pains to say that this is not a Ugandan outbreak, that the 2 confirmed cases in Uganda were both Congolese. One person died and was sent back across the border to Congo. The other is under treatment in Uganda. There is no local infection in that country. But that does not stop the US from declaring a travel ban. Anybody who's been in any of those 3 countries, DRC, Uganda, or South Sudan, not allowed into the US over the next 21 days. But this is the 17th outbreak of Ebola in the DRC. So why does it always happen in the Democratic Republic of Congo? Here's one public health expert.
Some of the populations actually eat bats, and therefore the exposure to the Ebola virus is much, much higher in the belt across central part of Africa, and particularly in the DRC, where Ebola virus was first characterized in 1976. And that communication between the human population and the fruit bat in the forest continues. And any time that a fruit bat has the Ebola virus, then the human being is exposed.
Health authorities in the Democratic Republic of Congo have become reasonably good at containing these viruses, but there is still some stigma around treatment. The health minister in the DRC is on the ground appealing to people who are showing symptoms to come out and get treated. They've set up 3 treatment centers. The World Health Organization saying it sent 12 tons of medical equipment and supplies over the past 24 hours alone.
Wetuliawo. Oyo Ebola mu region. Abantu bali obuwundo. Let me hope, but I'm praying, nti mu ggwanga lyaffe we don't have tribes oba abantu abali obuwundo. We have a lot of food mu ggwanga. Let me hope, I pray, we don't have such characters. Nti of all things, gwe olonzeyo okulya akawundo. And I'm not judging oba kusawo mbeera ku bantu ba DRC, but you've seen, because of their actions, right now tuli mawulire for wrong reasons. Because Ebola is etika, it's scary out there. Yes, fe mu ggwanga tuyinza okugamba it's just Ebola, but out there omuntu wawulira nti Uganda Ebola, there's something it does to our country in terms of image. So mu kaseera kano we shall keep monitoring the situation. Ngaye mbagambye, I trust our doctors in the country to handle this, the nurses. the healthcare system can contain this. Naye, it has to be collaborative. Buli omu alina okuzannya party ye. Otherwise, this can easily get out of hand ne tudda mu mbeera ya 2019-2020. Njagala ompe endowooza mu comment section wansi awo ku Ebola ogirowoozaako ki? Gwe omu ku bali obuwundo teeka endowooza yo mu comment section wansi awo. Nja kukola mu video eddako. Peace.